So learning and openness is absolutely essential. You know, these two cases, how you are able to see net self to mech self, from so many remedies to zero remedies, just by few days of puja. Now what happens? Very interesting. Some of the rubrics of asthma under puja, you will see how beautifully it covers. When can we give? Okay, this is another aspect. I'll talk about it after 2 minutes. So after this, I have tried this in many patients. When nothing works, if the patient is hot, we think of giving medorinum. It gives relief. If the patient has got repeated infection, we give few doses of tuberculinol or basilinum or thuja in increasing potency and doses and repetition. The patient definitely feels better. The patient, this particular patient from 67 lived up to even 87 or something without much of complications, without any problem. So you can imagine how could we extend the entire life without any complications, without any problem. Yesterday somebody asked the question, so I just put this. When can we give anti-miasmatic remedy? It can be given as an intercurrent remedy when there is a strong miasmatic past history of a particular miasm. So a lot of time, if there is a very strong, like if you, like in that particular case, the 18 members were suffering from bronchial asthma. So it becomes a very strong miasmatic history. So you can give thuja as an opening prescription. It is given if there is a very strong family history of any miasm. Example, tuberculinum to be used in strong family history of tuberculosis, and carcinosin in cases of family history of cancer. I have treated quite a few cases of cancer where 3 generations were suffering from cancer, and the 4th generation we have been able to prevent the cancer by just giving few doses of carcinosin. Another characteristic of carcinosin you should not miss is a tremendous craving for raw onion. 5 marks. They will say, I must have raw onion in my food, come what may. Doctor, I will not take your medicine, but I want to have onion. This is very typical of carcinosin. So anti-miasmatic, it can be also given as a constitutional medicine. Many cases I have treated where the constitution itself expresses as tuberculinum constitution or medorinum constitution or a thuja constitution. When the constitutional medicine stops acting, another reason, in spite of increasing the potency or altering the repetition. So you can increase the potency, alter the repetition, still in spite of that, if the medicine doesn't work, constitutional medicine doesn't work. When the patient gets acute exacerbation of illness very frequently, so recurrent attacks of bronchial asthma or rheumatoid arthritis, however, it must be noted that intercurrent remedy should be administered during a quiescent phase and not during the acute exacerbation. If you, yesterday I explained to you that if there is an acute exacerbation, if you give it at that time, it will double the intensity and very difficult to manage. By mistake, there was a case in which just before the quiescent phase, I gave tuberculinum, and the aggravation was so severe. For 14 days, the patient suffered. You know, that was a learning experience. I was so disturbed for 14 days, 2 weeks, the patient was suffering. So always when it is coming down and it becomes quiet, that is the time you give intercurrent medicine, not during acute exacerbation. Also, when all the indicated medicine fail, you may give this, that, all possibly cyclical medicine, rework the case, and still no result. Think of intercurrent medicines. When a particular miasmatic phase is dominant, Suppose patient comes to you straightway in psychotic phase, warts and asthma and rheumatism and spasms and period pain and everything possibility, extra growth of hair, all these are psychotic expression. So at that point, if that phase is so strong, you can just start openly with antimiasmatic. You can also give it as an acute remedy where acute illness or acute exacerbation expresses the symptoms of that particular remedy even in the acuteness of the problem. Like I talked about a case of cardiac asthma. The patient was having acute breathlessness. Still we prescribed medorinum, and that time medorinum becomes a phase prescription even with the worst of aggravation. But at this point you have to be very careful in repetition. The repetition has to be very, very guarded repetition. In case of diathesis, suppose for example recurrent cold, okay, it can be given to remove the tendency to. It can be used to remove the tendency. Like for example, tendency to catch cold, basilinum. Tendency to anything can be very well controlled. Tendency to suppuration can be controlled by sulfur. Tendency to cavities can be controlled by cephalinum. Tendency to infections, tuberculinum. Next is to stimulate vitality. If the patient is very, very low vitality and the patient reacts very poorly, okay, so vitality is low, sensitivity is low, susceptibility is low, the reactivity is so low that if you give a constitutional medicine, it will not register or it will produce aggravation. So this is the time you give intercurrent medicine to stimulate the vitality so that some reaction happens, some response happens, and some response will create openness to prescription. Coming to the result of this case, he felt so much better that it was like a new life for him. When the medicine stopped acting, we increased the potency from 30 to 200 and to 1 m, and finally 10 m of Thuja was given. No other medicine was given. The patient when the final report came, the patient was a president or a chairman of many organizations. So I explained you, I give Thuja to lot of chili patients or medorinum to heart patients in repeated doses if you are not able to come to a remedy. And these cases improve substantially. And we have been able to reverse the pathology and drug dependency. You imagine 13 tablets totally stopped. Now this is not something usually. So knowledge of posology is required, complete understanding of miasm, knowledge of when and how to prescribe antimiasmatic remedy is a must. So thank you very much.